Hello, my name is Daisy Gonzalez, and today I'm going to be talking about the use of imagery in nursing. So, today in this presentation, I will be answering the questions: what is imagery and how can we use it in healthcare? So, imagery, what is it? In the textbook Contemporary Nursing Issues, Trends, and Management, it describes imagery as a process of creating a picture or an image in the mind that can cause a specific bodily response. A lot of the times, imagery is often thought of as hypnosis. I think a lot of us just automatically assume hypnosis, you're imagining something, but the book does a great job of distinguishing the two. So in the textbook, it states that hypnosis uses imagery. However, image and suggestion are presented to the person, whereas imagery is an image that a person creates on their own. So hypnosis, you're kind of guiding the patient on what to imagine. In imagery, the patient is imagining things on their own in their mind. So why use imagery? So the use of imagery in healthcare can not only reduce costs, but it can also help many patients without the use of pharmaceuticals. So imagery can be used alone or along with medication. Imagery is used to reduce stress, pain, and anxiety. In a nursing journal titled Nurse's Guide to Guided Imagery, it states that guided imagery can help patients cope with many disorders such as cancer, migraines, IBS, hypertension, anxiety, depression, PTSD, and asthma. The article also goes on to say that guided imagery has been shown to positively affect vital signs, blood flow, gastric motility and secretions, and levels of various hormones and neurotransmitters. So those are all benefits of using imagery. So imagery in some cases has been shown to even be more beneficial than pharmacological approaches. So imagery and what the patient needs to know. So before using imagery, the nurse needs to assess the patient's willingness to try imagery, and you need to obtain a verbal consent from the patient. Next, you're going to determine the patient's need for imagery, so whether that need is physical, emotional, mental, spiritual, or environmental. You're going to assess the patient's understanding of guided imagery and their readiness to use it. So if a patient is really confused, you're going to kind of guide them through it, answer any questions they have, and just kind of reassure them. You're going to ensure that the patient is in a safe and quiet atmosphere during the assessment. And then where you also actually do the imagery, you want to make sure it's the same thing. You want the environment to be calm. You want the environment to be somewhere where the patient feels as comfortable and safe as possible. Because if a patient is feeling comfortable and safe, they're going to be more willing to open up and relax and fully engage in this imagery. You're going to begin by implementing generalized relaxation at first as a kind of like stepping stone to get into imagery. So we're going to advise the patient to close his or her eyes and focus on simple breathing techniques. So after this, you can kind of choose and adapt the type of imagery and what kind of imagery you want to use with your patient. So you're going to obviously use data that you gathered in the assessment, and then kind of get a gauge on how the patient's own views are in their reflective practice. So on the next two slides, I'm going to go over some types of imagery that can be used. And it was really surprising when I read that there's all these different kinds of imagery. So there's a feeling state. So this helps patients change their mood in a generalized way. This can be done by asking patients to imagine their favorite vacation spot or their favorite place to relax. End state, you're going to ask the patient to imagine already being in a situation or circumstance that they wish for. So imagine seeing oneself as healthy and strong or happy and successful. So end state is kind of what I think as like manifestation. I feel like it's pretty close to that. Energetic, so you're going to imagine life force energy free flowing through the body. So you're going to tell the patient to pull energy up from the earth through the soles of the feet. Cellular, patients imagine healing at a cellular level. So you're going to tell the patient to envision immune system cells as part of an army that attacks malignant cells with tanks and missiles. So up next is metaphoric imagery. This uses symbols to envision illness or healing instead of reality-based imaging. So you're going to visually think of radiation as rays of sunshine or a tumor as an enemy encampment. Next is physiological. So patients imagine events in the entire body. So you're going to have patients envision details of the body's anatomy and physiology. So a patient with shoulder pain may imagine each muscle in their shoulder relaxing and softening. Next is psychological. So this involves patients' perceptions of themselves. So if you have a patient who is feeling overly responsible or overwhelmed, have the patient imagine that the weight of the world is being lifted from their shoulders, the stress is leaving their body. And lastly is spiritual. So if your patient has a faith or a spiritual belief, you're going to have them make contact with God or whatever higher being they believe in. Some patients find guidance and inspiration by imagining their deity. Some may also be comforted by imagining themselves being held in the arms of God. So spiritual is obviously one that when you're doing the assessment, you can kind of figure out if your patient has any spiritual beliefs and then go from there. So next, we're going to talk about limitations and disadvantages of imagery. So first, some patients may produce imagery that can cause them to have more anxiety or get upset. So this is where the assessment really comes into play. If you have a patient who has severe PTSD, severe anxiety, or a patient that you know comes from a kind of rough upbringing, rough background, sometimes asking them to imagine things or using imagery on them is not going to help them, because when they close their eyes and they try to imagine things, it's just going to bring up a lot of bad memories. It can make them more anxious, and it's not going to be beneficial for them. Also, not all patients are going to react to imagery, and not every patient believes in imagery or trusts it. Imagery may interfere with other personal beliefs. So belief is a really important thing with imagery. If you have a patient who is just saying, they just don't believe in this kind of medicine, they don't believe this works, then this is not going to work for them. A patient has to be willing to try it and willing to believe that imagery can help them. So imagery and patient care. So some simple ways to incorporate guided imagery into everyday patient care. And these things are things that we can even use in the clinical setting, even as nursing students, if you're taking care of a patient. So when giving IV therapy, ask the patient to envision the fluid nourishing the cells in their body. While administering medications, you can ask patients to visualize the antibiotics attacking and destroying bacteria. When assessing respiratory status, encourage patients to breathe healing oxygen into their lungs and breathe out toxins. So, in conclusion, imagery is a type of alternative healing that can be used along with medications, or imagery can be used by itself. There are several different types of imagery that the nurse or the healthcare provider should be aware of, and they should cater the type of imagery they use to the needs and beliefs of the patient. So even as nursing students, there are simple ways that we are able to incorporate imagery into our everyday practice, which I went over in the previous slides. So some questions I have are, what is something you learned from this presentation? And should more hospitals try and incorporate the use of guided imagery into their standard practice? And this is my reference page. A lot of the information I got in this presentation came from the Nurse's Guide to Guided Imagery, and it's a really great article if you guys are looking for more information on imagery, looking to read up on it. This article does a great job of putting it in the nurse's view and perspective and ways that as a nurse you can incorporate it into your practice.